afternoon. I'm Ann Gibson. Thank you for joining us today. We're going to get started with our New Hanover County Schools Employee Town Hall about our transition to Plan B. We have senior staff in our room. Thank you for joining us remotely from your schools and your administrative buildings. Remember that you can put your questions into the chat, or you can submit questions via email. The email address is in the chat. You scroll up. So we'll get started with some questions that came in prior to today through that email address. First one, actually, before we get into the questions, let me stop a minute. I'd like to turn this over to our new superintendent, Dr. Charles Faust, to kick this event off. Dr. Faust?
Good afternoon, everyone. Sorry, technical issue right there. Good afternoon, everyone. It is my pleasure to be a part of New Hanover County Schools, and to actually, during this time, this is, one of the times I always say that your best teaching comes out under irregular times. And so that's what I believe that will happen, is that after this Zoom town hall, our goal is to make sure that your questions are answered, that if you are uncertain about anything, please put them in the chat so that we can answer them. The questions that you have are valid questions, and we want to be able to answer them. You get to hear them straight from the senior staff. And so it will not just be me talking, it will be everyone around this table who will be answering the question. So depending on where the question is, that individual, that department will be answering that question, the head of that department. So we're excited.
Thank you. We'll start with our first question for operations and Eddie Anderson. Are the students being split into two groups at the district level or at the school level? And tell us what those groups are.
That is being handled at the school level, and that is group one. We are now on what's known as the AABB schedule or model. So group one is A, group two is B. Group A will be attending school on Monday and Tuesday. Group two would be attending school on Thursday and Friday. And Wednesdays, all students are remote.
Thank you. Second question is a health question. It's student support services. If you're exposed or get COVID-19 from someone at school, how long do you have to quarantine at home?
Hi, I'm Julie Barnum, Assistant Superintendent for Student Support Services, and I've been chairing the health work group. And honestly, it kind of depends. It depends on whether the individual who's tested positive is symptomatic or asymptomatic. But we are following the public health toolkit that's for Strong Schools, North Carolina, and continue to refer to the, I don't know if you can see it, but a little chart regarding screening. And so if there's been a diagnosis but no symptoms, a person should stay home for 10 days since their first positive test. But if there are symptoms, there's a need to stay home for 10 days since first symptoms, but in addition, it must be at least 24 hours without fever with symptom improvement.
Thank you. I noticed some people we're still admitting people from the waiting room. I just want to mention that this session is being recorded, and that link will be sent out to everyone in case you're just joining us now. Next question, are teachers allowed to bring their school-age children to school on the remote day, which is Wednesday? Would that be students?
Sure, I'll answer that. Any student that is the child of an employee can still access the remote learning lab on Wednesdays.
Thank you.
And there is an agreement for that, so it would need to be planned for.
Can you tell us a little more planned?
So if you plan on bringing your school-age child to the remote learning lab on Wednesdays, make sure you're communicating with your school administrator because there's an agreement for the remote learning lab, and we also need to schedule to have enough staff. So that should not be a problem at all.
Thank you. Next question, what is the minimum mask quality for staff and students? Comment is 3-ply woven masks are the standard. I'm hearing from most health experts.
I'll take that one. Thank you. Again, we're utilizing the Strong Schools North Carolina Public Health Toolkit that the state provided to us. And what's listed on page, actually this part hasn't changed, but what's listed on the version, it's a September 4th version. There is a September 6th version, but so this is page 5. It might be page 4 or 6, depending upon the change. But at the top, it defines that cloth face coverings are not surgical masks or respirators, but they are, it says recent studies on types of face coverings suggest that multi-layered cotton face coverings provide good coverage to keep droplets from spreading when we speak, sneeze, or cough. And so it's honestly using the multi-layered cotton face covering guidance.
Thank you. And the Strong Schools Toolkit that you're referring to, that there is a link on our website, and the COVID case management, that document, that 24-page document is also available.
That is also on our website at the Ready, Set, Return under Health and Safety. Yes.
Okay, contact tracing has shown that many healthcare professionals contract COVID in break rooms. How is this being addressed at schools?
Okay, I'm going to take that one as well. Again, the toolkit suggests that we need to make sure that any place that students and staff congregate, they are maintaining at least 6 feet distance while using their cloth face coverings and can use additional measures such as a shield. So a shield along with a cloth face covering is additional protection for the person wearing it and others. A cloth face covering really is more about protecting others. And so the toolkit specifically reminds us for any staff area, such as a workroom, break room, cafeteria, any place like that, we should be maintaining the mask use and the 6 feet distancing. And if that's done, then generally we're not creating exposures. We have significantly reduced the risk of transmission.
All right.
Let me add one more thing. Based on public health data at this time, we have not found transmissions in our school settings with staff returning. There have been, while there might be multiple people who have tested positive, those aren't traced back to transmission at school. And in our community, as of last week, our hospital was reporting no transmission in the community based on being at work at the hospital.
Will the daily schedule stay the same for the students slated to be at home at any given time, or will they be expected to be online synchronously during their teachers' classes? Instruction?
Yes, so the daily schedule will change. The instructional team is working right now with our elementary, middle school, and high school administrators to determine what that schedule will be. There is the expectation that students at home be engaged with the students who will be physically present in the school. So there will be the opportunity for synchronous instruction while at home during the AABB schedule when those students aren't in attendance. It will follow what we have defined as the district as the flipped instructional model. And principals will be sharing information with their teachers, likely beginning tomorrow, and then training teachers on use and implementation of this model in their schools.
Another more general instruction question. What is the purpose of Plan B, especially for the higher grades? In other words, what problems does it solve?
what problems does Plan B?
So I guess I'm interpreting the question, what does Plan B give students that Plan C does not?
So Plan B gives students the benefit of face-to-face interaction with their teachers.
Some safety questions. What are the safety protocols for students eating lunch?
I'll take that one. And as Ms. Barnum said, I think anywhere that students or staff are congregating within the building, they are to practice the 3 W's as far as wearing a mask, washing hands, and waiting 6 foot apart. They will be doing that at lunch, whether eating in their classroom or whether eating in the cafeteria or other areas. And then following lunch, there are protocols and procedures in place for cleaning.
And what if meal delivery to, as far as students going through the line to pick up their meals served to them?
The meal delivery and where they're eating will vary because whereas when we were under the original Plan B, we were looking at a 3-week rotation. And under the current AABB plan, we've allowed schools to go ahead and work with their cafeteria manager to open up the cafeterias or other areas for eating. So some schools, it will be a school-based decision. Some schools will be able to eat in the cafeteria. Other schools may choose to eat in their classrooms.
How were health officials involved in the decision to move to Plan B?
Well, share that one. The Friday before the board meeting, I think it was Friday before the board meeting, Julie and I met with health officials for probably almost an hour discussing Plan C to Plan B, getting the data, getting their insight on it. And then when it was time for board meeting, I didn't believe there was a need to bring the health officials back to the meeting because I'd already spoken with them and asked those questions. So there was no, in my head, there was no reason to bring them back to say the exact same thing. When we talked with them, we asked, were there any concerns or barriers for moving from C to B, and we got their blessings. And so that's why we moved without having them come back to the meeting. And so it wasn't a fact of them not coming or not being involved. They've been involved, and then there's a health team where the assistant director is on that committee with some of the school officials. So the health officials are involved and have been involved from inception. And so we're getting up-to-date, sometimes daily information from health departments, health officials. And of course, the decision was not made in isolation.
Thank you. Will each school have enough extra masks that forget theirs at home, leave theirs at home?
I can answer that. We have provided masks for every student and staff member. At least 5 are in the buildings. More will be provided as needed. Principals can request additional if needed. And then in some cases, Julie might want to add to this, but there's some specific mask needs for specific students that, like clear masks for students that need it, will also be provided.
Right. We'll have a donation of shields that come in for every staff member and every student to use as an additional measure or along with other accommodations if there's a medical need. And many schools have kind of extra masks set aside for disposable use if students forget those, but we do have extras and we'll continue to order as we need.
And we'll also have the extras on our buses. So if a student arrives at the bus stop and does not have a mask, then one would be provided.
Will flu shots still be made available to employees this year? And what about when a COVID-19 vaccine is ready?
So I'll take that one. We do anticipate that we'll have a flu shot clinic again. At the meeting that Dr. Faust and I had with our health officials, we did talk about that. They had not received their flu vaccines at that time and weren't sure when they would come in, saw that they were a little bit on a delay, but we don't have any reason to believe that we wouldn't continue with our flu vaccine clinic as usual. And then regarding a vaccine for COVID-19, we would certainly utilize the direction of our public health professionals in making that available as folks want it.
How will staff be advised of COVID cases in their schools?
So if there's a positive case in a school, administrators are sending an email to the entire school staff, but they're doing that after they have reached out to folks that might have been in what we call close contact or potentially had exposure. And so, and I say this a lot, I'll say this one more time. We really are in a good position in New Hanover County Schools because our school nurses are public health employees and are already trained to engage in the school level contact tracing. So, and if a staff member notifies their administrators, then the administrators either contact the school nurse or me or one of us first, and we have an email template that reminds that someone on our team has been identified as positive. That's confidential, so the name isn't there. If somebody shares it themselves, that's fine, but we don't share that in an email. And advises that whether precautions were followed the last time the person was in the building, but that those who might have more close contacts have already been notified. And then working with the school nurse, which through contact tracing for public health in knowing whether folks need to isolate or not. We also have a spreadsheet on our webpage. And so under data, I've seen it. We have a spreadsheet on our district webpage that identifies those positive while maintaining confidentiality. Yep.
Thank you. Take a few questions from the chat at this point. Will the students be screened only once a day? Shouldn't they be screened again midday?
So I'll take that one as well. Again, following the guidance in the toolkit, we are doing the mass screening at arrival as required, but continuing to monitor symptoms. If anyone engages or seems to demonstrate symptoms throughout the day, of course, they are to be referred to the school nurse for additional screening at that time. But we won't engage in multiple screenings throughout the day, such as temperature checking and asking the questions of whether there's been exposure. But certainly if symptoms are identified, that would be referred to the school nurse. So it will be just monitoring of symptoms, but not a mass screening.
And what happens to students who refuse to wear a mask?
I think I'm going to take that one as well. Unless anybody else wants it.
Instruction.
If a student is refusing to wear a mask, just as, if a student is refusing to engage in other safe behaviors, of course, we would start with really trying to reinforce the use of it, helping understand the need for it. If we're dealing with a student with special needs, that's going to need to be dealt with or handled on an individualized basis, depending upon the child's developmental and communication understanding. But in general, if it's not a student with special needs, handling that as we would any other type of non-compliance. Number one, expressing the expectation, the desired behavior, reinforcing that desired behavior and, understanding the rationale for it. And then, of course, if we have to move through the other measures, reaching out with the parent for communication and collaboration on, again, why this is important and why it's necessary to be in the school setting. And again, I'm talking about general population. Any child with a special need, work through the case manager or teacher for that child to really support those other needs and whether there's an exception that could apply.
A couple of instruction questions. For families that opt for in-person instruction, are they allowed to float in and out of their in-person status?
I'm sorry, can you repeat that?
So
It's for instruction.
yeah, so if I understand the question correctly, if there's a family who is assigned to Group A and they want to be in attendance on week 1, but then they don't want to be in attendance on week 2. They do have that flexibility, just as if a child might have been absent. We would hope that families would communicate with schools what their needs are and why they're making the decisions that they're making, so that schools could better support them. But we would allow families those flexibilities. You would in essence treat it as you would an absence, unless there was a way that you could support that student through remote learning.
Thank you. Under the 1 week on, so this question is regarding the 3-week rotation, and we're in the AABB. But I'll rephrase the question to fit the AABB schedule. Is the face-to-face time equitable among the 2 groups in the AABB schedule under Plan B?
So I think if we're counting minutes and days, there are going to be some differences, but we find that same thing to occur in different calendars. Our year-round calendar might have a certain number of days, our traditional calendar might have another number of days. I think given the situation and the circumstances that we're under, the calendars that we've created are reasonable, and that the differences in the amount of face-to-face time is not so significant that it puts any particular group of students, whether they're in the AA or the BB schedule, at a significant disadvantage.
What is the expectation for the students who are in the classroom? Can they work on their assigned Seesaw Google Classroom activities?
So our teachers are the creators of their instructional delivery. And so it may be that teachers have specific assignments that they're going to be pulling from those learning platforms that they might expect children to engage in. But what we don't want is for what happens in the classroom to mirror what would happen if students were at home learning remote. So if the question really speaks to if a student could access their Seesaw platform to complete some work that maybe they did not get done when they were away from the face-to-face, then the answer to that would be the expectation would be, well, that would not be meeting the expectation. Our expectation is that during the face-to-face that we really optimize that learning and really take advantage of the fact that we have in-person and the opportunities for interaction, of course, socially distanced interaction, but interaction between peers and interactions with the adults that are going to be in the room.
Not all schools have school nurses. So what happens in the case, if there is a case, a student is showing symptoms?
So all schools have access to a school nurse. We have almost a 1-to-1 because we have about, I think, the equivalent of 41 nurses for 45 schools. And so all schools have an assigned nurse. If they're not there 100% of the time, they do have access to that nurse. And so if any administrator is concerned that you don't know who your nurse is, please call Kristen Jackson or me, and we'll make sure that you're aware of who your nurse is. But I think that we have that pretty well outlined.
Will classrooms be provided with desk partitions?
I'm sorry, what was the question?
Will classrooms be provided with desk partitions?
We have not purchased desk partitions for the general population. That is not in the guidelines. And if everyone is wearing a mask and everyone is practicing 6-foot social distancing, the desk partitions are not needed. They really don't provide any added benefit. Like Julie said, the best protection for you and others is actually a face mask worn in combination with a face shield. And face shields are provided for every student or will be provided through a donation for every student and every staff person.
Yeah, and I'll add that if there are students or staff that are seeking a mask exception, then that might be an additional accommodation that can be added to their setting to help maintain safety for them and others. But in general, with 6 foot distancing, it's not necessary.
And your special ed and
Right, and we may have situations where for special education purposes, such as evaluations with a school psychologist, services with a speech language pathologist, they will be using clear shields and clear masks, and possibly also those or the partitions to support with maintaining or mitigating transmission. A comment, our class numbers are increasing, and the question is, how do we ensure that we are able to follow the guidelines regarding space and social distancing?
well, I can start on that one. Over the last couple of weeks, myself and others in the school system have been out meeting with teachers, meeting with principals and assistant principals, and trying to configure mainly classrooms, but other spaces to accommodate the 6 foot social distancing. It's been refreshing to get back out in the classrooms and see how excited teachers actually are in some of the creative things that they've done to accommodate the 6 foot social distancing. Based on, I think my team has probably been to over half of the schools and are going to the remaining schools. And I would say I haven't seen anything that we haven't run across a space yet that we haven't been able to come up with a solution. So I don't foresee that as being a problem. I think through scheduling and through through rearranging furniture, that we'll be able to accommodate all the students.
Can you also address the rumor that the cleaning supplies the teachers are using in their classrooms to clean is considered a pesticide? Or perhaps just strong?
I do know that from earlier today, there was a concern about the product that's being used, but the safety data sheet that I saw was not for the product that we're using. It was for the fully concentrated version. And so it had some things in there that were a little scary. The product, we are using the QT Plus, but we're using it in a diluted form. We actually put one ounce of the product to 128 ounces of water. So it's significantly diluted, or 1 ounce per gallon. And we're following the guidelines and the recommendations in the safety data sheet in terms of how to use that and what PPE to use, and we've made those available to all the schools.
So Eddie, just to piggyback, is that something that the state recommends that we use?
Is
that just a New Hanover County thing?
Actually, the CDC is the one that's recommending that we use the disinfectant, and then the EPA has reviewed all of these disinfectants, and they have an approved list of disinfectants that schools are able to use to specifically fight against the COVID-19. And so this is on the EPA's approved list of products.
And a related question, do we know how that compares to what the hospital is using for cleaning?
I don't know what the hospital's using for cleaning.
If there are questions that we don't get to due to time or we're not answering now, we will drop those into an FAQ to follow up after the session. Let's see. If Wednesday is the misting day, why can we not be remote on that day?
Well, let me clarify that we will not be doing any misting while staff is in the building. when the electrostatic misters that we have purchased and distributed to the schools, to get the maximum benefit from the product, once it's applied, you really need to leave it for about 10 or 15 minutes. So we don't want to apply that when people are in the building or teachers are in classrooms. So during the school day, custodians will be doing the normal daily cleaning and disinfecting that they'll be doing Monday through Friday. And then in the evenings, they'll use the mister.
Thank you. More instruction questions. What is the rationale for moving to a flipped classroom if we are moving to a more traditional format?
So the rationale for moving to a flipped classroom allows us to maintain the higher levels of engagement for our students who are home, as well as our students who are in the classroom. In the classroom spaces, as the face-to-face classroom spaces, as shared earlier, the goal is to really optimize the opportunities for interaction between students, but we also realize that we have children who are at home. And so using the flipped classroom model or the flipped instructional model allows teachers to maintain high levels of engagement and meaningful instruction with those students while at home at the same time.
If a teacher is denied remote work and decides to use their sick days instead, will they be able to put those days in the system in advance, or will they have to do it close to the time when the students return for remote learning? Do you want me to repeat that?
Yeah, repeat it. I was with you for a fact.
All right. If a teacher is denied remote work, decides to use their sick days instead, will they be able to put those days in the system in advance, or will they have to do it close to the time when the students return for remote learning?
I think they're wanting to know how much advanced knowledge do we want them to provide to their principal that they are not coming to work, that they'll be using leave, and whether it's sick leave, family leave, FMLA. The sooner that the principal has that information, the better plans they can make to cover the classes.
But we would still use the same guidelines, policies that we've used in the past.
They're going to earn and use them the same way that they would before.
Yes, yes. The same guidelines right now is still in effect, that they earn 1 day per month. Of course, they have accrued sick leave. Regretfully, the state has not taken action on relaxing the standard that teachers can only use annual leave on non-student days. So that is still in effect. They cannot access their annual leave, but they can access their personal leave.
Right. And so you're answering the next question. Really, you're touching on what type of leave will have to be taken to cover quarantine. The teacher has to under quarantine.
The first leave that you go to for an ordered quarantine by the health department is to use the family first leave. And I think I'm using the right name. This is 2 weeks of leave that the federal government provides. That's good up until December 31st, unless it's renewed again after that. So that's the very first thing that we look at. Then after that, we would be working individually with each teacher to come up with their options and help them reach the best solution.
Thank you. There is a rumor floating around that the school day has been extended. Is this true? If so, can we know what that extended time is?
The school day has not been extended.
Well, it has, just like, so,
Sorry.
so prior to Dr. Pals.
Okay, good.
So prior to Dr. Pals, the decision was made in the development of the calendars not to schedule the calendars for 185 days of in-person instruction. The district opted for the 1,025 hours. And so to ensure that we're meeting the requirement of the 1,025 hours, we have added 10 additional minutes to the instructional day. This affords us what we are calling a cushion. So if we find ourselves experiencing inclement weather, then we're not going to necessarily have to immediately make that time up unless, of course, it's very extensive, because we are now exceeding what is required by the state. If we had not done that, then we would have not met our threshold, and we would have had to schedule 185 school days. And so it was a decision that was made prior to Dr. Faust in the development of all school calendars for the district.
Sorry, I've been under the hour system for some years now.
Yeah.
And just what you said, that's been the most beneficial part of it, is that you schedule by the hours versus the days. And that way, in the event that there's a snow, you're not making up. We're not making up days.
Exactly. And also a driver in this for us was to be able to end our first semester prior to going home for the winter holiday. And then also ending the school year prior to the Memorial Day holiday. And then we were able to add additional teacher work day because we knew that there would be the need for additional training for teachers.
So how many hours, so they'll know how many hours now would be consistent for one full school year?
So they vary a little bit across our calendars. Before you came, we had, well, a while ago, we had 9 calendars. We're now down to 7.
Okay.
So the hours vary a little bit across each calendar. But for the most part, we have created a cushion of at least, I want to say, 4 to 6 days.
Okay.
Thank you. For households in which multiple students share the same device, how will they be accommodated during Plan B when all students in the household will be expected to attend synchronously from home?
So first of all, households that have multiple students are able to check out multiple devices. There is no requirement that it's only one device per household. Matter of fact, I strongly encourage households that have more than one student to check out a device per student.
Great, thank you. Will more iPads be delivered to schools so students have access to technology during the school day to complete online assignments or complete assignments? I guess the question earlier, will more iPads be delivered to schools?
We have ordered more iPads and they had come in. Our first plan is to reach out to the 4th and 5th grade students who had to check out laptops to see if they're wanting to switch those for iPads. And then we will distribute the remaining. Same thing when we get more laptops in.
The student bathroom faucets only allow the water to run for about 5 seconds. How will students be able to wash their hands per CDC guidelines without having to touch the faucet handle over and over? Related. Will there be hot water for students to wash their hands? Will there be hand sanitizer dispensers secured in each class?
Wow, that was a lot. So yeah, the faucets in all schools or public places are required to be timed, and there is an adjustment on that. So if it's timing out and cutting off too soon, then just notify the principal or whoever submits work orders, and the maintenance department can come out and adjust those. You can also just use a paper towel to touch the handle, and that if you do have to hit that more than once, you can do that. Hand sanitizer has been provided to all the schools for in each classroom, and some hand sanitizer stands. I don't know, have they been sent out?
The stands are being sent out.
Okay.
They were received last week, and they'll be at higher traffic areas in the school. They're touchless. And then a little bit later in the school year, I think we won't get those until January, there will be dispensers on the wall in every classroom. But for now, we use the box.
And we have a video on our webpage about hand washing with Nurse Tammy and a couple of student models. And the water doesn't have to run the whole time because a lot of what needs to be done is the vigorous washing in, the nails in the back of the hand and all that. And then, if you use a paper towel or, your elbow or whatever to turn the water back on and rinse, but still rubbing underneath, then that should be sufficient.
Black and brown families are known to double the rate of positive cases when compared to white families. How will you help protect African American students and staff?
I'll start with that one. I think universally, we have to make sure that we're engaging in safe, universal precautions to support all of our children and all of our families, and providing sound instruction on how to maintain mask hygiene, hand hygiene, hand sanitation, and really teaching our students across the board how to utilize social distancing, how to actually implement the 3 W's, I think is going to be really supportive of all. And from the health perspective, really communicating with families and creating a dialogue with families as they need that based on any questions they may have or any medical vulnerabilities that put their family in a little bit more risk. I think having those conversations with the school nurse and with the school will be very helpful. Anybody else?
I agree. It's on where we should all be exercising 3 W's. And that's, I think, the most important portion of it. And that education is the best piece. And I think our school district has done a great job of the social distancing, wearing of your mask, and washing your hands. And that right there, I think that will be the prize that we need to carry home every single day. I don't think there's anything different that we would do for people of color that we wouldn't do for anyone else. And that's literally, I'm a person of color, and that's what I do. Wear a mask, social distance, and wash my hands.
Will we be allowed to open windows, if we are able, in our rooms to help with ventilation?
No, not all schools, classrooms are able to open windows, but I appreciate the question because we have over the past several months taken advantage of this time to complete all our preventive maintenance plans and a really good tune-up of our HVAC systems. The HVAC systems in our schools, it does provide outdoor air. The outdoor air that comes in through the system, it is filtered, it's conditioned, so we're not bringing in hot, humid air. We're not bringing in insects or other allergens, contaminants. So we would prefer you to use our HVAC systems to provide that clean outdoor air. We have increased the flow of outdoor air to the maximum that the system is able to handle, and which also increases the turnover of air within the building. So the opening the windows, while it does provide some outdoor air, it does come with the potential for a lot of other problems.
And the toolkit speaks to having windows open if you're on the bus and in the classroom, but if the unintended outcomes are potentially mold and more allergens, it's not a good idea. So, I'm saying that because I was saying it because it's in the toolkit, but I want to echo that Eddie's way more right than I am.
Got to tell it for you.
Many teachers have nearly 40 students in a class, so 1/3 of that is about 13, which violates the rule of 10 or less for indoor gatherings. What is your solution to this? And how have those?
Well, I think they're probably looking at the old guidelines. So, the guidelines for schools have changed, and I think it's gatherings of 25 or more, but school systems are exempt from that. So there is no limit on the number of kids that can gather in a classroom or anywhere else in the building. as long as we're able to, or they are able to accommodate 6-foot social distancing.
So related question, what solutions does the district have or have considered about schools that are over capacity? Similar type of question.
You know, when we've gone out to the schools and working with the principals and APs and the teachers, we haven't come across a problem that we haven't all been able to put our heads together and solve. Our classrooms are going to look different. We've taken some furniture out. We've put them in, you know, configurations that people aren't accustomed to. But it's a different time, and our classrooms will look different. But in every case, we've been able to accommodate the students that are coming back under the AABB model.
How do we address the issue of equity when teaching concurrently? Not all of our children will have someone at home during synchronous sessions. Does this cater to a particular sector of our student demographic?
I think we have challenges with equity now, and just as we had challenges with equity prior to the pandemic. Our emphasis and focus is on quality instruction, and we're working to build out our systems so that we are taking into account the needs of our families and our students, and providing devices for children who don't have devices at home, providing hotspots for children who don't have internet access at home. And then also in terms of childcare, we're providing opportunities for training for families so that they can also support children if they're not familiar with some of our learning management systems or don't feel comfortable with the expectations to support especially a younger learner at home. So we recognize that there are issues and concerns with equity, but we also recognize that there were issues and concerns prior to. And again, our goal is to mitigate those and to ensure that there's high quality instruction for all students.
Are we able to be closer than 6 feet to a student if we are both wearing masks for a short period of time to assist with instruction or other needs that a kindergartner, for instance, may have?
So there are going to be some times where you need to engage with hand-over-hand support or to intervene to support a student. We don't need to plan to have those times. We need to respond as necessary to support learning, but we should not create scenarios to stay just under 15 minutes or 8 minutes or whatever so that folks can sit together a little closer while wearing masks. Because the toolkit really does lay out for us that we need to plan for maintaining, and it actually says ensure there is 6-foot distancing even with masks between students, especially at times they congregate. So that means within lines, that it means also when they're stationary. So we can step into someone's space to respond and to support as needed, but it shouldn't be that we try to plan to do those. On the back side of that, if we are inside of another person's 6-foot space and someone tests positive, the contact tracing is going to ask whether that has been more than 15 minutes. And so we don't need to use 15 minutes to try to gauge, well, we can stay close, but only for 12. We need to plan to ensure 6-foot distancing, but certainly step in to respond because it doesn't create an exposure. Clear as mud.
It's challenging. I hear you. Can students stay 100% remote if we eventually change to Plan A?
So there is a complete virtual option for students, and that option is the virtual academy.
Are EOGs and EOCs still the end goal, and how are you advocating with the state policymakers to change the accountability model to leniency?
So I don't know if I would characterize them as the end goal. I would say that given current policy, it is still the expectation that students participate with the integrated testing and the end of course testing. In terms of advocating with policymakers, our district is a part of the large district consortium, and that question is a conversation that chief academic officers like myself and others across the district are engaging in terms of what does appropriate end of grade, end of course assessment look like for students given all that we're experiencing this year.
If you're exposed or get COVID from someone at school, how long do you have to quarantine at home?
Can you repeat that first part?
If you're exposed or you get COVID-19 from someone at school, how long do you have to quarantine at home?
So I'm going to answer that in two different ways, because exposure could be one response, and then a diagnosis could be another. So if someone has been exposed, and again, I go back to the screening flow chart. I have to keep pulling it out all the time. And it is on our, on this document right now. It is, might be at the end of this one. On the document on our webpage, the screening flow chart still exists, and it's on page 21. So if someone has been exposed but they do not have symptoms, they cannot go to school or be at school for 14 days since the exposure. Now, just helpful hint, if you know you've been exposed and you want to be tested, in order to make sure you get the most valid results, you need to wait 6 days from exposure, because the viral load has to build, or you might get a false negative. Okay, and then how long does someone have to stay home if they've been diagnosed? So if there's diagnosis and no symptoms, home for 10 days since the first test. If there are symptoms, it's home for at least 10 days since first symptoms. And then making sure you don't return until you've had at least 24 hours of no fever without fever reducing medications, and also improvement of any respiratory symptoms.
Will there be a way to do small groups at a table if partitions are not provided? Or will this be the teacher's responsibility to provide those, to provide, I guess, those partitions for small group instruction?
Is it asking, well, I mean, I guess it's gonna be hard for me to ask you if it's asking if it's less than 6 feet.
It's definitely less than 6 feet.
Yeah. Yes. So we are responsible to ensure that students are 6 feet apart when they congregate or when they're stationary. So I would not advise that we create a scenario for students to sit closer and try to put additional accommodations in the middle. Does anybody else want to?
No, I agree. We of course understand the benefits of small group instruction.
Absolutely.
It just has to look very different.
Absolutely.
Maintaining that 6 foot distance.
Yes.
Will there be a means for contact tracing in our larger schools? Large high schools likely have over 1,000 people on campus each day under AABP. Is there an exposure rate that would be tracked, may cause schools to return to remote learning? Will this decision be made?
Absolutely. So also on our webpage, we've got oops, I want to move to the other side of that. I'm using a very small screen on that, where we have the reference guide for suspected, presumptive, or confirmed cases. And in that guide, which was updated at the time of the governor's last announcement, which was on September 17th, so it's very recent, it does identify that based on any positives, any positive diagnoses in the building, we will work very closely with our local health department officials or public health officials, which starts with our school nurse. And our school nurses have access to the contact tracing and the contagious disease team at public health, because they are, on that staff. And so we have already been utilizing the expertise of the greater team at Public Health when we've had situations of potentially more than one person on a campus and really trying to find if there's any connection. But also these Public Health has the same documents. We've reviewed them through our health work group, and they're fully anticipating that that they will communicate with us at any point they determine that we have a cluster or an outbreak. And that's the terminology used for the number of positives that would potentially be in a particular place setting, such as a particular school. And they would advise based on that contact tracing that's done through contagious disease through public health, whether we would need to isolate certain classes, certain areas of the building, or even a certain school.
What is the plan for students of teachers who are working remotely? Will teachers lose their planning time to have to cover those classes? I guess we'll take the first question. What is the plan for students of teachers who are working remotely?
So if I understand the question correctly, and assuming those teachers' children attend school in Hanover County, then they would either be on the AA or be scheduled. So their children would be in attendance during their scheduled group. If their children are not students of children who attending Hanover County schools and their current district is still in Plan C, then those children would have access to the remote learning lab.
I do think it's asking about their own classes of students.
Yeah.
Okay, yeah, read it, I'm sorry.
What is the plan for students of teachers who are working remotely?
Students of teachers.
So if I'm a teacher and I'm working remote, who's going to actually take those kids?
Oh,
And am I going to have to give up my planning period to support that classroom? I think that's
Yes.
okay.
so what I would say is those decisions are being made at the school level, and a lot of them are being driven by the available staffing. And I apologize for completely getting that one. I'll turn it back.
But I think your other information was helpful.
Yes, students.
Still good.
Okay. How will you make sure that each teacher is prepared and provided with the capabilities to Zoom before students enter the building? What are the Zoom resources?
Okay, so we have provided guidelines on our current Zoom configuration setup, and the expectation is that every teacher is using the Zoom account that's tied to New Hampshire County Schools. And I will gladly make sure directions are sent out again if need be to the principals to share out. So we are working on a process where we are purchasing a licensed account for every teacher. And then with that, there's a way we can create basically accounts for students where they're having to authenticate, but yet students are not able to schedule or host meetings. So we're working through that process. The purchase order was issued last week. We're making sure that the vendor has it, and we're working through that process now. Will we have it up and ready before kids come back? I don't know. I won't know until after the meeting later this week. So if it's not, they'll continue doing what they have been doing for the last 9 weeks. You know, a lot of it is monitoring. You know, you need to watch who you let in the, from the waiting room into your classroom, verify that they're your students before you let them in. Definitely the teacher needs to be in there first. Kids need to be in the waiting room. You need to make sure the kids are muted, and that they're only, unmuted when they're trying to talk. Classroom monitoring. It's different. It's virtual classroom monitoring versus physical classroom monitoring.
A lot of those tips and techniques are on the website,
yes.
under technology and teaching and learning.
Yes.
Will there be COVID testing available for teachers as needed?
So we do not require and will not require COVID testing. That is something that each person determines is appropriate for themselves in consultation with public health and with their own medical provider. But if staff are concerned with their exposure and they feel like they should be tested, again, we would encourage them to reach out to their medical provider or to public health, because it is our understanding that anyone who feels that they need a test based on potential exposure has been provided that.
With masks, what will the protocol be with any type of wording such as politics, gang-related colors, and other types of language?
I'll take that one as well. And I'm going to reiterate something that was shared with our administrators in our principals meeting last week. Yep. So with regard to anything that we might wear, and so this, I think, applies to other policies that we already have in place. We should certainly consult our policy 6420 with regard to political activities on campus as it relates to masks or anything that might be written on a mask, and looking to determine if there's a disruption to the educational process that's been created. Otherwise, our employee dress code, which is policy 6435, and our student dress code, which is policy 8520, also addresses any items that should or should not be present on one's attire. And again, the threshold is that anything on clothing or on a person's attire shall not disrupt the educational process. So we think we really need to utilize our current policies to help define whether there would be concerns with items like that. Anybody else want to add?
I agree. And please understand that whenever there's a presidential election, it's always a high intensity week, month prior to the elections. And so the same things that we have done in the past would be some of the same things that we're doing, just as Julie was stating. You know, if it's a distraction, then that's when we have to jump in. If it's not a distraction, then there's some rules and legalities that we have to follow. And just because a student wears a political propaganda that does not align with what we are, doesn't mean that's a distraction for the teacher. It has to be a distraction for the classroom. And so there's more policy in there. And we can definitely point you in that direction, point the principals. I think we do better at pointing the principals, and so they can cover it. I think that would be a good discussion for staff meetings, so that everyone can get more clarity and go all the way down into that question, so that you're familiar with it, because I think it's important for us to understand, because students are going to be students, and you know that, as I know that, and we just want to make sure that we're following the policy and not getting anyone out on a limb, and that they're doing something that will adversely affect them as an employee. So we want to definitely make sure that you are abreast with the correct policies, and that you can have that discussion at your school with your principals, and we'll make sure that they get those policies out to them.
Have students been instructed not to bring their devices back and forth?
No. We have basically told schools that you can't require the students to bring their devices back and forth, but you can ask them to.
You know, I also believe that once teachers are trained on the flipped classroom model, they'll get a different understanding of when the device is needed or when it's not needed. I think what everyone may be thinking right now is that it's going to be remote, and then in-person remote.
Yeah.
And so I think that's what maybe you're thinking, but give it a couple of days. Principals are being trained today, tomorrow, today.
So today, they were elementary, middle, and high school principals were trained today.
Okay.
So their plan is to work with their staffs and train their staffs starting as early as tomorrow.
Okay.
And maybe as late as Wednesday.
So you will get training as soon as was stated, tomorrow through Wednesday. Those will be the starting days. But just imagine I was having a conversation with a teacher who does some IB, and so I know everyone isn't trained in IB, so that's not what we're pushing. I don't want you to take that away. But project-based is what she called it. She said, well, can I call it project-based? Call it project-based, call it flipped classroom. It's some of the same concepts. So you'll get a better understanding. I think at that point, you will understand what is needed from the students and what you'll be needing.
Question wondering how to have face-to-face students in a room while operating a Zoom with at-home students.
I think they're going to get more of that information starting tomorrow from their principals. That's what we're training them on.
All right, we have about, well, we're closing in on 20 minutes left, and we are continuing to get a lot of questions. So as I said, we will be developing an FAQ document as a follow-up. And just a reminder, if anyone arrived late, that this session, the recording of this session will be sent to you when we're finished here today. All right, another question. The question about middle school schedules, we're getting a number of questions about this. Having 6 Zoom classes a day while remote, and how this should be managed.
So again, we're working to develop a middle school schedule that we think meets the requirement for instructional hours for students, but also is not going to be overburdensome on teachers. The principals did receive training, and that was a part of the conversation and the discussion in their training today. And so what I would say for folks is allow your principals to meet with you and have that conversation about what that will look like and how you will manage that. And then if there are additional questions after that, then as principals meet with our director of secondary education, they can bring those questions back and we can work through those.
Will school playgrounds be open for recess?
School playgrounds will be open. In other words, the fields, the blacktops. I would say that school or playground equipment or structures will remain closed. And yeah, I understand the confusion because a lot of public playgrounds have opened, but schools are operating under a different set of guidelines. It's recommended that the playground structures not be used, and if they are, that they be cleaned and disinfected between groups of students. I think this is an effort to maintain, student bubbles or pods. The feasibility of doing that is prohibitive, and so we're going to go with the recommendation that the playground structures and equipment will be closed, but the playgrounds, other playgrounds will be open.
Is there a plan in place for emergency situations like lockdowns?
There is, and that information has been shared with the principals last week. We will be following our lockdown and other drills and those procedures. Fire evacuation drills, they'll follow the normal procedures. We'll just have to social distance with about 6 feet. Lockdown drills, teachers will be reviewing with students, what the expectations are as they do each year. And then when that drill occurs, students will stand up beside their desk, point and describe what they would do under a normal situation. So our lockdown drills will look a little different to maintain that social distancing.
If a child does not pass the health screening, what are the procedures?
So if it's going to be a different procedure if the parent is still there. So if it's in the car line, if the child does not pass the screening, then the child does not get out of the car, stays with the family, goes home, and then the screener alerts the school nurse that there was a reason why a child did not pass the screening. If it's a child that rode the school bus because they have an attestation form on file, where the parent attests that they will self-monitor for symptoms and not send their child if they're sick, but then they come to school and at screening before coming in the building, they are identified as not passing the screening. they will go to the isolation room, which is we're calling the Cove. I think most schools are calling it the Cove, per school nurse recommendation. Felt like isolation room was a little scary. And so they will go to the Cove. The school nurse will be notified. Likely in some schools, the school nurse is going to verify before a kid goes into the Cove. And they'll do a secondary level screening. And they may decide, well, actually, no, I asked the question in a different way. And again, it says use professional judgment because you're listening to the responses of, no matter what we're talking about, responses of kids, minors, when asking the screening questions. And so if a school nurse says yes, at secondary screening, this child goes into the isolation or Cove, then it's the responsibility of our school staff to be contacting families to come and pick the child up. In the isolation Cove, in the Cove, I really like to use the correct terminology, but I'm going to try to model use of the Cove. Students must still maintain distancing. The staff member who's supervising maintains distancing. And, we've been having this conversation with administrators and especially student support staff that we've got to make sure we have enough contact numbers for families so that when a student is sick, that we can contact someone to get them home and get them to care if they need it.
Gotten this question a couple of times. What number of positive cases would trigger a school closing?
So again, that is a determination of public health based on their wide variety of data that they use. Generally, and I want to try to quote this correctly, but in looking at the numbers, I think they would certainly identify whether there's been a cluster or an outbreak, and I think the cluster starts with maybe 5. I don't know. Let's not go with numbers. The whole point is we stay in, as Dr. Faust said, daily communication with public health, and if we have a need to close a classroom, a grade level, a particular building, or a whole school, that won't be a surprise to us. We'll be monitoring that situation and communicating with our school families.
We're still getting a number of questions around Wednesdays and the cleaning that occurs on Wednesdays and staff being required to be in the building. So can you talk a little bit about how that's coordinated?
Well, and I saw one of the questions too, that there was apparently there's a schedule that was issued where the misting is being done during the school day. That should not be the case, and we had provided some guidance last week for schools. We are following the CDC guidelines in terms of cleaning and disinfecting our buildings. We have procedures and protocols that our custodial staff will be following. We're using all products that are on the EPA's approved list of products for COVID-19. They will be cleaning and disinfecting on a daily basis. And far more routine cleaning and disinfecting during the school day while staff is there. The only thing that we've asked our custodial crew to do and our schools to do is use the electrostatic mister when staff has left the building. And that's really not for a safety issue, but because the longer you can leave that product, this is not something that you apply and you wipe up. This is something that will attach to the surface, and the longer you can leave it alone without disturbing it, the best, you get the maximum benefit of the product. So if you applied it and 15 minutes later you wiped it up, it's probably only going to protect that surface for a minimum amount of time. Whereas if you'll let it dry naturally, you get the maximum benefit. So that's why we're asking the schools to use the misters after staff have left the building, and that's typically being done on Wednesdays.
So what I hear you saying, Eddie, is there's no real such word as what I'll use. I think a lot of schools would say we're gonna deep clean. You do that every single day.
We are cleaning and disinfecting every day.
Okay, and so the same products that you would use on a day-to-day basis are being used every single day.
Every
It's
single
not
day.
just on a Wednesday, you're using something different. The only thing you're saying on Wednesdays, they may demystify or use a static in some of it, but it's coordinated with principals.
Correct.
Okay.
Thank you. How much time do you anticipate screenings to take in screening all the students coming off the bus, walking, and car riders? So how will that look?
Yeah, depending on the size of the school.
Yes, and it's also, as Dr. Faust said, it's going to depend on the size of the school. It's also going to depend on the number of screening stations that the school defines. So every school has created their screening organization or their screening management, and principals have identified the number of screening locations. I know that we did that with the week on, 2 week off rotation, and so now with the AABB, I think there will be a little bit of different student numbers, but we are also piloting I've been trying it out at one location, use of the Power School documentation of screening to see how we can make that happen more quickly. So I think in the beginning, we need to expect that it's going to take longer until it becomes a little bit more automatic. And I know I was talking with where we piloted today, one principal was saying that for a kindergartner, it honestly took 5 minutes to screen that kindergartner, because it's the first time and it's a kindergartner and wasn't even sure of last name, and said, well, before we do that, can I show you this picture I drew? And so it was the dialogue, that was not a good measure of how long it's going to take to screen a kid. And they're like, yes, I did have a fever when I was a baby and I was in the hospital. And so we've got to create some automaticity in the screening process so that we can move through it more efficiently. But in the beginning, it's going to take a little bit.
What will the instructional piece look like on Wednesdays? Will teachers be Zooming all day and all students attending synchronously?
So the expectation is for remote learning on Wednesdays. And if we reflect on the definition of remote learning, it could be synchronous, it could be asynchronous. It also could be those families that have elected to do print packets. But the expectation is for remote learning for all students on Wednesdays.
And does the flip model classroom address teaching students who are 100% remote but not in the virtual academy?
We're creating our own definition of that. And so again, I would wait for teachers to get a little more clarity under the new Hanover schools way, because if they look up the definition of flipped classrooms, it's going to give you one definition, but however, our admin, our team, our academics team has taken bits and pieces to create what's called the New Hanover Schools flipped classroom.
Thank you. Do we treat all fevers and cold-like symptoms as COVID?
I think that would be a great question to ask the nurse, but in the absence of that, again, I'm just going to be a good steward of using our toolkit. We do not have a way to differentiate cold and flu symptoms from COVID-19 symptoms. And so in the absence of that differentiation, using the most safe problem solving would be, yes, symptoms of those kinds. So the symptoms, the short list of symptoms are fever, chills, shortness of breath or difficulty breathing, cough, or loss of taste or smell. But we also know that a more extensive list of symptoms have been identified to include, it can include stomach ache, ear infection, congestion, runny nose, headache, fatigue, muscle ache. So and even on the on one of the screening tools, it says even if there's potentially ear infection or some similar illness, there could be a presumptive positive. So we are not in a position to decide which symptoms are COVID-19 related and which symptoms are cold and flu related. So they will generally be treated the same unless we know the difference.
And are the children allowed to get on the bus without an attestation form?
My official answer is children are not allowed to ride the bus without an attestation form on file. However, we all know that it takes a good 2 weeks for us to get into and children to get into a pattern. And during the first couple of weeks, we're going to, if a student shows up at the bus stop and they do not have an attestation form, we are going to allow that student on the bus and provide them an attestation form and ask that they bring that back the next day, signed by a parent or a guardian. Beyond that, we will be working with the school to reach out to the family to try to get that form submitted. And obviously at some point, we would not allow the child to ride the bus without the form on file.
Let's see, we have time for probably 2 or 3 more questions. And then, as I said, the recording of this session will be available. We'll email that to everyone. And also there are going to be questions we are not going to get to, and we will be dropping those into an FAQ and address those. And let's see. Middle school students sharing computers with their siblings during the day. How will they be able to attend the Zoom sessions? I think you addressed that earlier with the device.
We've asked students, if there's any student who needs a device, we will gladly check out the device to the student.
So what I would say,
They don't need to share.
if a teacher knows of an individual who is sharing the device, please let the office know so they can reach out, or the teacher can reach out to the individual and let them know that they can get a device. We want all students to have a device. There's no need to share.
Have there been any upgrades to the air filtration systems or a HEPA or the equivalent? And they're referring to not opening the windows, but wondering about the ventilation systems.
Right. So one of the things that we did as part of our preventive maintenance over the past 6 months is you put in the maximum allowable filtration that we could, and still run our systems at an optimal level. So we are providing that extra filtration, and we're also changing those filters more frequently.
What if a teacher has to quarantine due to exposure or illness but can still work from home? Are they required to use sick leave?
I think it would, I guess, be up to their supervisor whether or not they were able to work remotely.
Some of these questions are duplicates. Will the county be supplying each school with goggles, gloves, clothing coverings? And we're going to talk about those kinds of PPE. What they're used for, who they're appropriate for. Do we have them? Do we need them?
So we do have an infection control and PPE guidance tool, and our principals have that as well that we provided and we discussed. So in this document, it really helps identify what PPE is needed and by whom. And goggles is not something that's listed, but we, like we mentioned a little earlier, all staff, some staff already have face shields. All staff will be given an opportunity to have a face shield that they keep and reuse, as well as students having those too. So This goes through the different PPE supplies that have been provided to the schools and when they might need to be used. And also keep in mind that if staff are involved in more in situations where transmission of the virus could be higher, they're going to need additional training from the school nurse on how to use that PPE, such as a gown. If you're going to be wearing a gown because you're in a situation where respiratory droplets might be getting onto your clothing, then you need to be trained on how to take that gown off so that you aren't re-releasing that into the air. So we need to be reminded to utilize the guidance we have if we're concerned with what additional PPE we should have besides a mask and gloves and the general provision. Let's make sure it's appropriate for our situation and we're in consultation with our school nurse.
Also, along those same lines, even if it's not related to the job function that you have, if you have a medical need that may require additional PPE or other accommodations, you need to discuss that with the principal and use the form that was provided. And principals have been encouraged to approach this from a can-do attitude, as long as it's not disrupting the school program. If it does require additional costs, then other things will have to be checked out. And principals have also been told that if they have doubts about it, to contact HR so that we can discuss it with the individual.
What will be restrictions for the public going into buildings under Plan B eventually Plan A?
So for now, we are limiting to the essential folks. So for now, it's going to be our employees. And at this moment, they're students who come into the remote learning lab, their children who come in the remote learning lab. When we move into Plan B, we are still limiting visitors and volunteers and focusing mainly on those folks that really need to be in the building for providing services or receiving services. And I'm sure we'll be in consultation with public health as we move along and determine how well our screening processes are going, how well our mitigation of transmission of the virus is going in the building before we identify the need or the opportunity to bring visitors or volunteers in. Anybody else?
Okay. Will NHCS be transparent in the number of positive cases in the schools? I can start that one. Yes, the district started publicizing cases through press releases initially, but over time we adopted the practice that many districts are adopting, and that is posting the cases, and it is current. That grid is under the Ready, Set, Return information on the website, and that is updated as cases are confirmed.
Yep, exactly.
And it is 5 o'clock. So I'm going to reiterate one more time, the recording of this will be available. It'll be emailed to everybody, all staff. And you can continue to drop the questions into the chat until we sign off. And you can also email any follow-up questions to the email address. We'll include that when we send the link out with the recording for today's session. Thank you for participating. We know we did not get to all of the questions. It's a long list. We'll take a look and we'll address those that we haven't addressed yet. And we appreciate your participation. Dr. Bass, if you'd like to.
Sure. I want to thank you all for your questions. It was really good to hear from you. Unfortunately, that we have to do it this way versus in person. But what we are committed to is making sure that safety is at first. And again, we're not going to put you into any environment where we feel that it's unsafe. That's not what we would ever do. A lot of your questions, I think there is the packet that Julie has. I think we can reiterate where to find that packet, because I think a lot of you had questions. And what we were doing was actually going right to that packet to answer your questions. I think that would be really great. And then we need to make sure that principals are also transmitting the information to you that we've given to you, because a lot of those questions we had also given, not saying that you can't answer those questions, but we want to make sure that you're not being left out and not certain of what we're telling the principals at the principals meeting. So find out when their next staff meetings are so they can also address those questions for you. I think that would be advantageous for you all. But again, thank you so much for your time and willingness to hang in there with us from the 3:30 till 5. And, it's been my pleasure to sit here and listen and, learn more from you as teachers and understand that your anxiety levels, or to help monitor your anxiety levels. But our goal again is to make sure that you are well informed. Thank you so much and have a good evening.